For centuries, religious groups have extracted hallucinogens from plants and used them in their religious ceremonies. The first hallucinogen ever made by humans was in 1938 when a Swiss chemist working with a pharmaceutical company made LSD. For years, this chemist worked on this compound and 5 years later experienced the effects firsthand, in which he calls it an uninterrupted stream of fantastic pictures, extraordinary shapes, with intense kaleidoscopic play of colors. The pharmaceutical company then tried to make the medication in 1947 as a form of treatment that would help psychotherapy and also an agent to help study psychosis. In the 1960s, this drug was further used by Harvard psychologist Timothy Leary, and then LSD began to be produced illegally and sold on the streets. Until in 1970, it was blocked by the governmental agency that's responsible for monitoring drugs. Much of the research of this drug was stopped for many years after, but there seems to be a resurgence over the past 30 years about how this drug can contribute or help with mental disease. One of the drugs in this class that has been studied is psilocybin, which is derived from a mushroom and used by Native Americans in Central and South America for spiritual experiences. Psilocybin is thought to help stimulate the serotonin receptor, and when taken at high doses, can lead to changes in one's sensory perception, including causing hallucinations, how one senses the environment, and provide someone with a sense of a euphoric feeling. Some of the most common adverse experiences with this drug is this heightened sensitivity to their environment, such as being fearful of other people's facial expressions, getting more anxious or scared. Studies have shown that people taking psilocybin and having psychotherapy along with it, their mental health symptoms tend to be less severe, and it improved directly in correlation with the spiritual or meaningful experience behind the psychedelic-associated therapy. These drugs were further shown to not cause further psychotic illnesses, which I'm going to be honest was a little bit surprising to me, but rather it unmasked what seemed to be an underlying psychiatric disorder that was already present, or that people were susceptible to them, such as they had a family history of schizophrenia or psychotic disorders. They were more likely to get psychosis themselves from using the drug. But these studies were in a controlled setting. In uncontrolled settings using psilocybin, such as like the street, a survey was done that shows that nearly 40% of people experience significant fear, anxiety, and psychological distress. Nearly 25% of these people have those symptoms last for longer than a week. MDMA is another type of drug that was initially formed by the pharmaceutical company Merck in 1912, and initially was created to help prevent bleeding and decrease blood clotting. But it was not effective for that, and at that time it was discovered that it had some psychoactive properties. Then later in the 20th century, approximately 1978, was this studied in more detail. MDMA is similar in structure to amphetamine and mescaline, and it's often referred to as ecstasy, which is a popular drug used in dance parties called raves, where it alters the emotional state. MDMA is classified as a Schedule I substance by the Drug Enforcement Agency, meaning there are significant concerns about the toxic effects of this drug and its potential for substance abuse. MDMA has been shown to work on a number of different molecules in the brain and even increase the amount of oxytocin hormone in the body. And oxytocin is a hormone that is thought to play a role in trust and social bonding. MDMA has been shown at times to decrease depression and also suicidal thoughts. Interestingly, a research study done with people that suffered from post-traumatic stress disorder and received MDMA while undergoing supportive psychotherapy, the combination improved their symptoms. The combination of MDMA and psychotherapy helped them with their symptoms of trauma. At this point, psychedelics are not typically approved for mental health treatment. There are some exceptions though, as ketamine is often referred to as a psychedelic or has similar properties as some psychedelics, and ketamine is used to help treat depression and also suicidal ideations in controlled settings. And ketamine is approved by the Food and Drug Administration or the FDA to help treat depression. In conclusion, most psychedelics are not approved for treatment at this time and should not be taken unless in a controlled and supervised setting by trained professionals. With that being said, many people have concerns about taking medications for mental illness in general. They may see that as being weak, or maybe they're afraid of their side effects. While side effects are possible, these medications are rigorously studied by many health professionals, and for the most part, for most people, the benefits of taking the medication will outweigh the risks if recommended by a clinical professional, by a trained professional. God is the true physician, and God may or may not provide healing in a case of a disease. Yet at the same time, God has gifted humankind with the creative ability to make these medications, oftentimes from natural plants and substances in the environment, in order to help others with their suffering.